guys, welcome back to Medical Coding with Blue. Today's episode is all about medical coding specialties, what you should know. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got a message from a viewer who was kind of confused about this very topic. But I will start off by saying this first. If you are thinking of pursuing medical billing and coding, just know that you have to know about everything. Even though there's specialty credentials out there that employers don't really ask for, but people get them because they get excited. That's another episode for another time. But what I will say is this. You do not have to be specialty certified in order to code for a specialty. Case in point, I have been an orthopedic coder for the last 13 or so years, 13, 14 years now. I've been strictly in ortho and podiatry. But my specialty requires me to know about everything, not just about the musculoskeletal system, but it also requires me to know about the endocrine system. It also requires me to know about the vascular system. So if you are thinking that you want to be in medical coding and you think that you need to start studying before you get into the school about a specialty in particular, you're on the road to ruin, because you're going to have to know everything. And there's already plenty for you to learn that you don't need to be adding to it. So let me read this and then we'll get into it. So the viewer says, so watching your videos, I hear a lot about specialties, but what exactly are the specialties? I understand cardio, neuro, ortho, right? But I've heard corrections being a specialty. If you work for the Department of Corrections, that is not a specialty. That is a place you can work. It is not a specialty. I didn't understand the other parts that she was saying, so I'm going to skip that. Do you have any videos explaining these specialties, their differences, how to know where to start, etc.? So I won't answer questions about like how to get started, where to get started, because 1,500 videos on the channel, guys. You guys can look, okay? And where to get started, how to get started studying, I've covered it so many times. I'm like a broken record at this point, so I won't do it anymore. But I will answer this. When it comes to learning and learning about medical coding, you're going to learn everything. These books back here, the ICD-10-CM book, it goes through all the different things that could affect the body. Infections, oncology, musculoskeletal, vascular, is cardio, right? And so it goes through every single thing. And same thing in the CPT manual. You're talking about the different procedures, right? That there are the integumentary system, the musculoskeletal system, the cardio, ortho, neuro, you know what I mean? Like it goes through every single thing. And so when you're learning these things throughout your program, or if you're learning independently, you're going to learn all about how the body is interconnected, because you're not just going to learn about one thing. It's like doctors, how they go to medical school, they learn everything, and then they choose a specialty. We are not that way as coders. Even though I have coded pretty much exclusively for ortho in the last 13, 14 years, right? Exclusively with them, I can code anywhere because my knowledge says I'm competent, and of course I know what I'm doing and I know how to research and start in a new clinic. So that's just what I want to say right there. It is not about, oh, well, I work for corrections and that's a specialty. Corrections is not a specialty. When you work, if you decide to work for the prison system, right, and you say, well, you know, they're hiring over there and they're looking for somebody to be in their medical records department or for coding purposes or whatever, that's one of like most interesting places to work, because you're going to be seeing lots of different things, but you're also going to be seeing lots of injury coding as well, because lots of things happen in the system, right? And there's injuries that occur. So because of that, you're going to have to know about ortho, right? But it's not just those things. There's lots of other things that affect people that are in the prison system. So those are things that you have to consider. It is a setting where you work. It is not considered a specialty. There's no chapter for corrections in the book, okay? I'm just saying. There's no chapter in there at all for that. It is going to be about the entire body system and all the things that affect people. Okay, that's why these books are so big, because they cover every single diagnosis code known to man or known to human. Okay, right out there right now. So that's what you have to know when you're studying for medical billing and coding. When I see people get excited about this and they start asking all these questions about specialties even before they get started in the school, I really kind of try to discourage that, because it's really easy to get overwhelmed with all the things that we have to know as coders. Coders have to know medical terminology, anatomy, pathophysiology, okay? Then you have to understand the organs and what they do and their process in the body. You have to know about that. You have to know about pharma. There are certain words I cannot say, so pharma is what you're going to get. Those things you have to know, and how do those things affect the body. And don't get overwhelmed, because these are the things that you are going to be expected to know after a while. You will not learn everything in the first year. That's why I tell you guys, you need 9 months, 12 months, or 18 months. Yet I still get people who will write to me and say, well, I signed up for a 4-month program. I think I can do it. Okay. 4 months to learn all you need to learn for medical billing and coding? I don't think so, because you're not just going to learn about medical terminology, anatomy, and pathophysiology, and pharma. You have to know about the medical law and ethics. You also have to know about ICD-10-CM, which is our diagnosis codes, CPT, HICS, PICS, ICD-10 PCS if you're studying for an inpatient credential. You got to know about the guidelines. You got to know about how to fill out these forms. You got to learn about the electronic health record. So there's a lot of things that you're going to be learning. And going in circles, looking at, oh, what about this specialty, that specialty, that's not going to do you any favors, okay? Medical coders can work a lot of places. The prison system is one of the places that you can work, obviously. There are jobs in there for coders, okay? Now, depending on whether they have you working on site or they have you working at home, I mean, that's entirely up to them, because not all prisons are run for like the state or federal. Some are privately owned and they just have contracts. So those are different things altogether, okay? There's also coders that also work for mental and behavioral health facilities, like those inpatient hospitals for patients that have mental problems, behavioral health problems. There's coders that are needed there. Nursing homes also need coders. Dialysis centers need medical coders. Hospitals, obviously, and private doctor's offices. Although I would recommend strongly that if you are getting into medical billing and coding, that you avoid at all costs working at a private doctor's office, because a private doctor's office has a limited budget. There's usually the spouse that is running the show that often, 99.999% of the time, has no formal education in coding or in billing, okay? Now, I said 99.999% of the time for those of you that want to get upset and say, oh no, but I work in I do. Okay, no. I'm talking to those who are trying to get out there, and I'm trying to keep them from getting taken advantage of, because smaller doctor's offices often have an all hands on deck approach. So if the coder is there and their front desk person has called out sick or something, guess who's coming up to the front to lend a helping hand? I'm just saying, and that's not what you're hired for. You're hired for the coding, okay? And so I want you guys to keep that in mind. You know, there's a lot of people that say, well, you know, you can apply at all these places, you know, if you're desperate to get work, but you also need to be mindful that you have a trained skill, okay? There's a difference there. And if you say, well, everybody wants experience, but it's free to apply, isn't it? So why are you not applying? I don't know. Why are you not applying the free tips that I give out for resumes, right? For coding specifically? I don't know. Time to do a little research, okay? So that's what you have to know there. But like I said, if you are getting through coding or coding school self-study, and you say, well, I really have my heart set on working for, you know, psych, you know, doing that kind of coding. Okay, well then just make sure that you are applying at those places that have those coders. But know that it's not just those diagnoses that are going to be affecting the patient. It's also diabetes or hypertension or hyperlipidemia or atrial fibrillation. These are all different specialties, right? But you're still picking up the diagnosis, because it's not just that one thing that the provider has to consider. It's like the ortho provider that has to consider the patient who has diabetes. A patient who has diabetes cannot be given certain medications because it can cause their blood sugars to spike, right? So if they're trying to think of like, okay, how can we treat this patient for their pain? We need to give them an injection, but I can't give them this medication because it can cause their blood sugar to spike. They have to consider that and think about that. So you would have to pick that diagnosis up if you see it in the documentation. And then if it gets even more complicated, because if they have peripheral neuropathy along with it, you have to make sure that you use the correct code. But you got to be able to spot those things. So it's not just you knowing about the bones, which is fantastic. Bones, tendons, muscles, it's not just you knowing about that. It's you knowing about the whole body so that you can code appropriately. Okay. Now, again, I don't want y'all to be scared. I want y'all to be prepared because it's not just one thing. I think a lot of people think that it's just one thing. It's like, again, for OBGYN, they see everything. OBGYN, when the mother comes in, there's advanced age for a mother, right? Over a certain age, over the age of 35, they're considered elderly gravida, which is a weird thing to say. But they do have that. And if that mother is a smoker, that can also affect that baby. So you have to pick up those codes. If they have diabetes, is the diabetes pre-pregnancy or is it during pregnancy? Because some women, when they get pregnant, they're only a diabetic when they're pregnant. And then once that baby is delivered, then they're back to normal. Their body starts to be able to regulate that blood sugar better. So those are things you're going to have to know. It's not just, oh, I only code this. You're going to code for all the diagnoses that patient has that are relevant to that encounter, okay? And that the provider has to consider in order to make their medical decision about the treatment of that patient. So that's just something that you have to know. Don't get into a one-way street about how these things are in coding. And some people will think that it's just one thing that they're doing. And same thing if you code for PT, physical therapy. Oh, it's just what they're coming in with. But there's other factors that could also be affecting the care for that patient. Same thing if you're coding for the chiropractic clinic. If they had a fusion in their back, that's something that you have to know that you got to be able to pick up. And there's other things that are affecting that patient. That maybe they have rheumatoid arthritis. There's a lot of things that affect not just the specialty that they present to, but other conditions that they have as well. And you knowing about those conditions is very helpful. And knowing like the brand names of some of these more popular medications, so that way you can be like, okay, well, it's long-term use this if I have to pick this up, because I know this does not make sense yet. But long-term use medications, some of them, like anticoagulants, that can really affect a patient's care. So you're going to have to know all these things. It is about knowing a smattering of things about the body in order for you to be able to code correctly. But just know this, you'll have the document in front of you. And once you've been practicing, working through your workbook and practicing on your own as well, you'll start to be able to recognize like picking up certain things, okay? And that will come with practice. You're not going to know it the very first day you start as a medical coder. You're going to be very slow because it's new to you. And then depending on the electronic health record that they have, that also plays a part in it as well. So again, I want to say this to my new people that are researching and thinking that they need to be specialized as soon as they get in. No, you don't have to be specialized as soon as you get in. Your credentials, if you sit for one of the 4 main medical coding certifications that employers look for, the CCS, which is the gold standard of medical coding credentials, because it says you've mastered inpatient coding and outpatient coding. There's a CCA, Certified Coding Associate, that says you have entry-level competence, which is still a fantastic credential. No one could ever tell me anything about the CCA because I had it for 13 years because I was tired of hearing people trash talk about the CCA when it is a fantastic credential. It is very difficult to get, and people who trash talk it often would never be able to pass that exam. I'm just saying. And then there's the CCSP, the Certified Coding Specialist Physician Base. That's all outpatient coding. And these 3 are with the American Health Information Management Association. Then there's AAPC, the American Academy of Professional Coders. They have their flagship credential, the CPC, the Certified Professional Coder, and that's all outpatient as well. So these are the 4 credentials that employers look for. All you need is one, and each one of these 4 has this in common, that they test you on every single specialty. So you got to know a little bit about everything, which means that once you pass this test, one of these tests, and you get out there in that big bad world, you can code for anywhere. You're not just limited to ortho. You're not just limited to cardio. You're not just limited to neuro. And if you want to know specifically about all the specialties and everything, take a look at your ICD-10-CM book, your diagnosis book. It's going to break down all of those different specialties that are out there, okay? Based on like the chapter, you know? But not all of them, obviously, because there's not an external cause clinic out there that falls under ortho, right? Or podiatry, or the ER, or family practice, because family practice, you see everything. I've done videos before about places where coders should try to apply right out of the gate, because it'll give you exposure to a lot of different specialties, so that way you can know, hey, I really like coding for neurology, and then you end up, you know, really wanting to get into that, and then you apply at a neurology place as a coder. Well, then you start to pick up, and that's how you can get, you know, very specialized. You can totally do that, okay? And some people have done that. They've bounced around to different specialties. Some will stay in a certain specialty for 30 years. It really all depends on the person. You know, I've done everything. I've done a little bit of everything. So even though mainly I have been in ortho for 13, 14 years straight, ortho and podiatry, it doesn't mean that I can't go anywhere. I have been asked before, and I have rescued several clinics. Pulmonary clinic was one of them. Neurology clinic was another one. Rheumatology was the other one. And so I've been asked to step in and do like my digging and find out what the problem is and be able to educate. And I'm able to educate any specialty based on my ability to do research. And that's what you do. That's what you get good at when you're a coder, okay? But these things take time. So if you're out there and you're starting to look and you want to explore more about learning, the first thing that you need to be concentrated on is medical terminology, anatomy, and pathophysiology. That's what you should be looking at first. Not about what specialty should I get into, what about billing? No. You need to know about all of those things, because a biller who doesn't understand medical terminology should really be ashamed, okay? I'm just saying, because I'm specifically saying about billers because it's not required that billers are certified in coding at all, okay? It's not required. Yes, there is billing credentials out there, but it's not required. It's not a requirement of the industry. What they see billers doing is processing claims and sending them in. What I see billers as doing, and as billers, if they're being ethical about it, they should understand what it is that they're pushing through, because what they push through affects 2 very important people: the patient most of all, and the provider. Well, and the facility, if I want to really get into it. Because think about this, these 3, if you screw up as a biller who's processing and just pushing on through, oh, well, the provider selected it, and you don't know what you're doing, and you just pushed it on through without a second look, well, guess what happens? If that insurance company says, okay, we'll go ahead and pay this, what if that code is wrong? So now the patient is out more money. They're already sick, and they already have all of these financial burdens going on, and you just made it worse because you just pushed it on through because that's your job, right? Let's think about this ethically now, right? Do you understand medical terminology, anatomy, and pathophysiology, and these codes to really be doing this correctly? Shouldn't you be studying that? That's what I'm saying right there, okay? And you got to know about everything. Well, then here's the provider. The provider gets more money. Okay, great. Because we just pushed a code through, didn't really think about it. Well, now let's do an audit from the insurance company. The insurance company says, let's do an audit. Well, now that provider is going to get punished because there was an incorrect code that got pushed through and got paid. And because they found it on an audit, and the office or whatever didn't, basically rat themselves out and say, hey, we made a mistake. The insurance company came and found it. Well, guess who now is in trouble? That provider. Guess who loses out on financial incentives? That provider. Because it started with the biller. The biller submitted the thing through and not even take a second look. Well, no, our providers only want these ones. But ethically, we are all bound to do this correctly. Whether it is selecting diagnosis codes, selecting procedure codes, we are all ethically bound to code correctly. It doesn't matter what the provider wants. The provider is there to take care of the patient, and we are there to interpret that documentation so that it can get paid correctly. Again, not trying to scare anybody, but I think a lot of people have a cavalier attitude about what this industry is and what we actually do, and how what we do affects so many people. That gets left out a lot when people are talking about this field. Oh, you can work at home and you can make all this money and you can travel. All this BS. That's what they talk about. Not talking about how what we do impacts the patients financially, the provider financially, the facility financially, ourselves, and our professional growth. Well, I'm here to say that because I want y'all to think about that. That's not, if that's not what you want, there's plenty of other people that'll sell you whatever you want to hear. Trust me, there's plenty of them out there. But I love this field so much, and I've seen so many people be taken advantage of, and it just pisses me off. It's so bad because I see that. And when I see comments like this, I know somebody's in this person's ear, filling their head with all kinds of garbage. And it's disheartening. I can't even speak. I can't even speak because it's so disheartening. But I want y'all to think about that. Not, again, don't be scared. Don't be afraid. Don't second guess. I want y'all to say, okay, that's true. I should know about medical terminology, anatomy, and pathophysiology instead of worrying about all these places that I could work or worrying about all the specialties and trying to get technical. No, you don't need to get technical. You need to get your foundational knowledge now. That's what you need to do. That's where you need to focus on. Because if you start trying to focus down all these little things, guess what's going to happen? You're going to get overwhelmed. I already have a base foundation. I had a base foundation knowledge before I got into ortho 13, 14 years ago. I can't remember what year it was, but it was around 13, 14 years ago. I already had a base foundation. I had already been coding at a bunch of different places. I had coded for inpatient professional fee services. I had coded for oncology coding. And that oncology coding was my first job out of the gate. You want to talk about tough. That's like you're thrown into the deep end of the pool. There's no hand holding there. That was a rough place to start for a brand new coder with no background in medical at all. But I did it, and it was a good experience, which it led me to my second job working for inpatient professional fee service. Okay, when a patient is admitted to the floor, I saw everything from mother baby to psych patients to broken bones and hip and everything else. So I seen all of that. People who came in with heart attacks and strokes and all that good stuff. There's lots of things that I learned about different specialties at that time. Okay, different subjects. Okay, but that led me here to my forever home, which I still worked in inpatient professional service. Then I worked for behavioral health. Then I worked for TBI, traumatic brain injury. Okay, because every facility has their own thing, and some facilities have a whole burn unit. Okay, there's some that they do fantastic work at these burn units, and they do lots of advanced therapy for people who have been burned, right? But there's also ones that they do lots of really great work for people who have suffered traumatic brain injury. So there's different things at different places depending on where you go. But you, as a student, as somebody brand new, needs to be an open sponge and not try to zero in on something. You need to make yourself this sponge for anything and everything that you set your mind to as far as getting into this field. The coder that is out there, or the student that is out there saying, well, I want to do this, and they get fixated on it. then you start to not look at other things, and then all the other stuff falls away, but you're really good at that one subject. That makes absolutely no sense, because you're going to just limit your ability to be able to go in anywhere. And trust me, there's plenty of limitations already for brand new medical coders. Some are self-imposed, and some because, the people that are, hiring don't know any better. There's those people too. Not everybody that's in leadership knows everything about coding. And some of these people haven't coded in years, have never coded, don't even know what the certifications are, but they know they need to hire somebody that's certified in coding. So that's just what I want you guys to know. But don't get fixated like this, okay? Don't listen to this kind of stuff. Like I said, I don't answer any more questions about like how to get started, because I got plenty of those videos where to get started learning medical coding. You can even Google it if you don't want to go through my YouTube channel. That's totally fine. You can Google me. I'm on the Google machine. So, but that being said, we know a little bit about everything, and that's what you have to know too. And when you are getting into this and you are starting to do your research, don't try to narrow down a specific specialty and, I want to do this. I want to do neurology. I want to do cardiology. That will come in later. Because when you get in the real world, you may decide, hey, I don't like that. I don't like coding for cardio. I would rather go to neuro, and you work in the neurology clinic, whatever the case may be. But the coder that is most successful is a coder that is adaptable and that is resilient and that will take those falls, because you're going to fall several times. Teeter-totter, right? You're going to fall and you're going to get right back up, and you're going to study and you're going to learn and you're going to keep moving and pushing the ball forward. That's what you're going to concentrate on, because getting distracted with all this other noise about different specialties and using semantics and trying to drill down, no, you're just wasting time at that point. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Best of luck to you. If this video helped you, please like, subscribe, and share, and I'll see you all next time. Bye.